Hi, my name is Shannon Stewart, and I live in East Vancouver. I've been a resident of East Vancouver for about 10 years, and I used to live here about 27 years ago. My son was born here. I can speak for this community partially. Lots of us, I think, feel that as we have lived here over the years and have seen the drug crisis in the downtown east side, it's sort of morphed as the years have gone by. There used to be a lot of needles, syringes, and now we are faced with something that is really frightening. I remember telling my friend, it's like you're looking at a Hieronymus Bosch painting when you walk around or you take a bus or you drive down East Hastings. It has been like that for years, but I think it is getting worse when you see the effects on the people. The fact that people who are using fentanyl and openly on the streets are no longer able to stand up. Their bodies are twisted and I believe permanently wrecked and ruined. I think the people of Vancouver, as we watch this happen in our city, are confused. We'd like something done, and we do wonder where the politicians or the people who have the resources, when are they going to step in? How can they step in a way that is going to help that community? I know I run an Airbnb in East Van, and I know I have guests come in, and every time I have guests come in, I have to explain the downtown east side to them, and a common statement they make is they've never seen anything like this in all of their travels around the world. Neither have I. And we hope that someone will listen. Somebody might do something, because these are people who have lives and voices and families, and they have been taken over by a drug that is incredibly frightening.
Like Shannon Stewart from East Vancouver, I also live in a community with a drug crisis in inner city Melbourne. A supervised injecting facility was opened in North Richmond in 2018. It has saved and changed lives, offering easy access to counselling, rehabilitation options, and practical support for people who use drugs. We need more of these services in our cities. Our state government has rejected a recommendation to establish a second facility, despite acknowledging the positive impact the North Richmond facility has on people's lives and on the state budget. How do drug-impacted communities engage governments to save lives using these health-based solutions? G'day, my name's Judy Ryan. With the help of the Winston Churchill Trust, I travelled to Canada, the US, Europe, UK and Ireland in August and September this year to learn how those countries have done just that. I recorded 31 interviews with a variety of people and share 12 of these in this two-part documentary. Part 1 features politicians from Canada, Scotland and Ireland, a researcher from Oxford University, and even a visit to a small drug consumption room located in St. Paul's Presbyterian Church in Hamilton, Ontario, Canada. First up is Senator Larry Campbell from Vancouver. Larry has also been the Mayor of Vancouver, the Chief Coroner for British Columbia for 20 years, and 9 years in the drug squad as a member of the Royal Canadian Mounted Police. Larry will explain the 4 pillars drug policy: harm reduction, prevention, enforcement, and treatment.
Welcome to British Columbia, and you brought the Australian weather with you. I love this.
That's lovely to be here. So I'd like you to address today the issues we've been discussing around the 4 pillars of supporting people with addiction, and you've had a lot of experience that you'll share with us today.
Well, there's too much to discuss in a short period of time, but the main issues that I like to deal with is first of all, saving people's lives. I think that that's incumbent upon all of us. I think developing and using policy that shows results and actually works. And third, but as important, taxpayers' money that is spent on addressing addictions, which is a medical problem, not unlike any other medical problem. And the fact that by addressing that through the 4 pillars, you find yourself with lower costs for emergency room, police costs, social services, healthcare nurses, you name it, and the disease we call addiction affects those bottom lines. And so not only is it good because we should be trying to save people's lives, but it's good because it also is financially responsible. I'm a politician. It wasn't my first line of work, but I was a politician. And so I was constantly, as we all are, constantly thinking about what are we doing? How do we spend our money? And are we getting the best results? And when you look at 4 pillars, you realize that at one point, harm reduction needs to be up there. So supervised injection sites, needle exchanges, everything, Narcan, everything to do with harm reduction. Prevention, to me, it's an underutilized pillar because we know that we can identify people who are having troubles very early on. In high school, I think probably the people most are the guidance counselors, or at least what I had as guidance counselors. They understand people who are dealing with poverty, racism, abuse, just being a teenager. And if you can't understand what that term of just being a teenager is, then I'm probably not getting through to you. Enforcement is important, but enforcement is only important from the point of view of interdicting the drugs that are coming into your country. Arresting addicts, somebody who uses drugs or sells drugs to support their addiction, is counterproductive. It's a waste of time. For the most part, nothing really happens. And with the way, being a former police officer, with the way police work is now, you're going to spend hours and hours and hours of precious police resources filling out forms, documents, what have you. Treatment. Treatment is one of the critical areas because, and here are the issues with treatment. First of all, it has to be on demand. So if I'm an addict and part of my addiction is that I need drugs, if I find a moment where I say, you know what, I got to stop this, I need to go into treatment, and we don't have it. You don't have it. And so treatment is critical. Here in Canada, in Alberta, the government pays for treatment. So if you need treatment, hopefully you can get it. They haven't reached the point yet where the critical mass, where they have enough spaces, but they're working on it. And so treatment is critical in this whole thing. And I don't differentiate between treatment. I don't differentiate between total abstinence or at the other end of the scale, some people are going to have to be given medication for their whole life. I had cancer. I take medication all the time. If you're an addict, it's a medication. And so I think that, the 4 pillars, everybody thinks they're level, but they're really not. They're up and down. From a political point of view, if you believe that addiction is an evil, evil thing, I don't think I'm going to get through to you. If you believe that addiction is a medical problem that a person gets themselves into for any number of reasons, poverty, abuse, racism, lack of education, self-esteem, if you understand that, then you know that they're in deep pain. And what they're basically doing is self-medicating. I was a coroner for 20 years. I met people who were addicted every single day. Not a single one of those people ever said, am I ever glad that I became addicted?
I'd now like to introduce you to Paul Sweeney, an MP in Glasgow in Scotland. Drug issues were not on Paul's radar when he was first elected to the Parliament in 2017. The drug-impacted community where he opened his electorate office in Postle Park, which is one of the poorest areas of Glasgow, demanded that he do something about it. Paul supported community activist Peter Crikant, who crowdfunded to open an illegal supervised consumption room in an old ambulance due to the Scottish and UK government delays.
So my name is Paul Sweety. I'm a member of the Scottish Parliament representing Glasgow, and I was first elected to the UK Parliament in 2017, and I've been a member of the Scottish Parliament since 2021. When I was first elected 7 years ago, drug addiction and those kind of issues wasn't really something on my radar. I didn't have a particular interest that I'd brought in to politics. It was something that I couldn't avoid as a member of Parliament representing one of the poorest communities in the city. Once I set up my constituency office in Saracen Street in Postle Park, it was an issue that literally was happening outside the door. People dealing, people injecting, people who quite clearly were struggling with addiction issues. And indeed people in the community came to see me saying, look, we're losing a lot of people out there, particularly in relation to benzodiazepine use, so street Valium, which has become an increasingly big problem in Scotland in the recent years since the National Health Service has changed its prescribing policy. That combined with opiates and use of cannabis and alcohol and cocaine is a heady and toxic mixture, which has led to Scotland having the worst drug death rate of any country in the developed world. And indeed in Glasgow we're losing someone on average every 8 hours to a preventable drug-related death. This precipitated a movement in the city looking at other countries around the world to establish an overdose prevention facility or a safe drug consumption facility. Unfortunately, when I was elected, we had a Conservative government in power, so I was in opposition, supporting councillors and other community activists in the city to try and get a permission from the Home Office department of the UK government to allow for such a facility to be piloted in Glasgow, but they were very hostile to it. Despite our persistence with it, there was very little progress, and the Scottish government, UK governments were in a kind of stalemate over the issue, making very little progress, to the point where there was just real exasperation within the community, and it culminated in 2019 at a public meeting in the north of the city where I represented, where an activist called Peter Crikant had just got up so overcome with frustration and said, look, if this is going nowhere, I'm going to just start this facility. I'm going to crowdfund them, I'm going to do it now. And if someone comes down and arrests me, then so be it, let's have it out in court. And indeed I was sympathetic to his frustration, having felt it myself, and was immediately drawn to his attitude of just get on with it and let's throw the gauntlet down. That's why it's so important to run these facilities and use them as a baseline for working with people where they are at, instead of setting tests that people are doomed to fail, whether it's the methadone programs or heroin-assisted treatment, which doesn't really operate at the scale needed to tackle the problem and on the level that it's manifesting itself in Glasgow. So I found it really useful, and I'm really pleased that Glasgow will be launching an official pilot as of the middle of October 2024, and hopefully that will build the evidence base on an official basis to show that it works, and we'll see the scaling up of those facilities across Scotland and hopefully the UK. I've certainly got a members bill that I'm bringing forward to try and license these facilities, so we're using the pilot as an initial evidence gathering exercise. We've already got a lot of evidence from the unofficial pilot, of course. Gillian Shorter at Belfast Queen's University did a lot of work with Peter and I and others to gather that evidence, but let's build this evidence case and hopefully roll these facilities out. The rate of people we're losing every day in Scotland, we can't afford to continue to dawdle, so I'm really keen to move forward with it. I'm just frustrated that it's taken us 4 years to get from the launch of the unofficial pilot to the launch of the official pilot. It's a really scandalous amount of time that's been wasted.
I'd like you to meet Senator Lynn Rowan from Dublin. Lynn was very involved in drug support services before entering politics. She supports public consultation, and in 2017 there was big support for drug decriminalisation in the community, followed by a citizens' assembly on drugs last year in 2023. Lynn says that the public is always way ahead of the media, of the institutions, and of the politicians.
So I'm Lynn Rowan. I'm a senator in the Irish Parliament. I was elected in 2016, and previously to that I developed drug services across many different working class communities in Dublin. Since being in the Senate, I will probably say the Seanad, but the Senate, it's obviously the Irish translation is Seanad Éireann, which is the Senate. My first piece of legislation that I tabled was actually on drug decriminalisation of simple possession. And at the time, you could see there wasn't huge support, maybe a small bit of support, and that would have been in 2017. And I think in the space between then and now, I think a huge amount has changed in terms of people's openness once they hear the evidence and they understand the issue and they understand that prohibition has not worked as any sort of deterrence, and actually between the judiciary and policing, that those policies are actually quite harmful. After the decrim legislation hit the floor, the minister at the time would have asked me to pause the vote on that piece of legislation because they wanted to carry out a public consultation to kind of get the feel of the nation, I suppose, on their views on drugs policy. And that was the largest ever response to a consultation from a state department, the health department. And I had in and around 22,000 responses, largely and overwhelmingly pointing towards a health-led approach to drugs possession. From there, the department set up a committee, a working group, which was led by a retired judge at the time. And I think that they kind of maybe took a more retrograde step, not taking on board, I suppose, the intent of the public consultation. And the judge at the time, who was the chair, the retired judge, he had a minority report that went completely against any sort of drug decriminalisation. But the rest of the committee suggested a number of different options, and decriminalisation was not one of those options. A kind of adult caution system was in there. And really, that's down to policing, and I think that that's very clear. That's down to policing, and policing not wanting to actually give up their stop and search powers, which is harmful to communities, especially communities that are over-policed, because it's just a very actually classist application of the law in terms of who's most likely to encounter a guard, a policeman in their day. And the communities that are most affected and most impacted by drug use are going to be the ones that encounter guards on a much regular basis. So from there, we kind of moved then into a new iteration of the government. There was a lot of campaigning at the time, and the Green Party, Nessa Horgan particularly, campaigned to have a citizens' assembly on drugs to be part of the programme for government. And thankfully that happened. It happened a bit late in the government's term for me, because now we're up against the clock, because that citizens' assembly reported. It was a very positive engagement with huge support again for the decriminalisation of the individual, and for the type of drug doesn't matter. It's about the person, and it's person-centred, and it's to ensure that people do not end up in the criminal justice system for their personal drug use or possession, regardless of whether that's drug dependency or recreational drug use. So from there now, it was back to Parliament, because obviously they have to legislate, and a special committee was set up that was made up of the both houses, the upper and lower house, of which I am on that committee. And we've been looking at the different policies from around the world. We've been getting the evidence in, and it's really up to us now to create legislation that actually stays true to what the public have been saying for many, many years. I think politicians always felt that the public was against this, but as is usually the case, the public is always way ahead of the media, of the institutions, and of the politicians. So really now, this committee, this Oireachtas committee, Irish Parliament, is due to report on its findings, and we've heard from people from around the world, police commanders, UN commissioners, lots of different people that are working in places who have decriminalised. So hopefully by December this year, that Oireachtas committee will report on its findings, and then it's over to government to legislate. And the reason why I say I think it happened a bit late in the government's term is we are facing into an election very soon. So my fear obviously is that a report will be developed and then we have to start all over again with a new government. But I do hope that that's not the case. I do hope that the conversation has changed enough that it just automatically falls into the next government.
I met Ben Shirt, a PhD candidate from Oxford University, at a conference in Birmingham. Ben was researching people who use drugs in drug consumption rooms in Birmingham, Vancouver and Athens. He found that people who use drugs want to be heard, they want to be welcomed, they want to feel safe, and they want to trust the staff in these facilities. His main finding was that the lack of peers in a service resulted in people publicly injecting and not preferring to use the service. He realises that involving peers maximises the engagement of the people who use drugs, and that there's flow-on benefits for the community because they no longer have so much publicly injecting.
So my name is Ben Sher and I'm a doctoral researcher at the University of Oxford. And I actually grew up in Vancouver, Canada, where I worked in overdose prevention centres for 3 years before coming back to the UK and starting my PhD. And in the PhD, my research is looking at the experience of people who use drugs and access overdose prevention centres, but in 3 different countries, and looking at the different models of OPCs that exist around the world. So started off in Birmingham, here where we are right now doing this interview, where there are no overdose prevention centres, and so the focus there was looking at is there a need for centres to be opened over here. The second was in Vancouver, where in the downtown east side there's I think 10 overdose prevention centres now within a 2-kilometre radius, ranging from low barrier peer-led models all the way up to very highly medicalized models. So you've got a full range of services there. And then the third location was Athens in Greece, where about 2 years ago now they opened the country's first sanctioned site, which again is a highly medicalized model. And what we found through this research was really what people want out of an OPC is the ability to feel heard and welcome and safe. They want a space where they trust the staff, they trust the people around them. And the mechanism of the OPC which facilitated this was really the involvement of peers in the design and delivery of the service. So in Vancouver, for example, you had services where it was a peer who would welcome the client at the door, who would sit with them while they were using, who would talk to them about injecting advice, who would then sit with them in the aftercare process. And really the clinical member of staff would only get involved in the case of an overdose or if they were really required. And the peers were trained in terms of speaking about all the other services that were on offered, so the peers were able to connect people to housing and healthcare services. And then moving on to the research we did in more medicalized facilities, we saw that when there was a lack of peers within the service, there was actually still a fairly large number of people who were still injecting in the street who weren't coming in. So really kind of the major finding from this research was people want to feel safe, they want to trust the service, and involving peers in that is kind of the crucial piece of the puzzle. And it's not saying that all services need to be entirely low barrier. It's brilliant when there is investment into OPCs and they can have more of those medicalized services. All it requires from that point is a really small tweak and to add peers in. And yeah, that's how you maximize engagement and maximize the benefits for people in the community who really, really could benefit from an OPC.
Thank you, Ben. And just after your incredible research and travels through Greece and Vancouver, obviously, and in the UK here, what gives you a sense of hope about the future of OPCs or drug consumption rooms in the world?
Yeah, definitely. So there are a few things that give me hope. Having done all of this primarily qualitative research and spending a lot of time interviewing folks who use OPCs, doing focus groups with people who use OPCs, really kind of the benefits that people get from it beyond kind of the clinical metrics, so like engagement with treatment or engagement with housing or less wounds, for example. All of these things are super important. But beyond those metrics, what gives me hope is kind of the message from people that coming into an OPC makes them feel cared for by their government. Coming into an OPC makes them feel like they're a part of society, and that they are valued as community members, regardless of whether they are currently in treatment, currently using drugs or not. They're someone's brother, someone's sister, someone's kid, someone's family member or friend, and an OPC is really symbolic. It actually goes beyond those public health metrics that we're so used to hearing about. So just really kind of, going to these three places and hearing those stories of how these facilities make people feel, that gives me hope that if we can get those messages across, that will encourage policymakers to open more of these services. The second piece that gives me hope is actually we are seeing these services spread around the world. When I started this research, there was only 11 countries that had OPCs. 4 years later, they're now 18, with countries like the US opening up OPCs, which back then when I started, you'd never in a million years think that the US would open up services. So I think that it's catching on, the benefits of these services, not just in places where there's high numbers of overdoses. Obviously responding to overdoses is really important, but actually anywhere where you have a community of people who are using drugs and don't have a safe space to go, who aren't ready to engage in treatment yet, an OPC is needed, whether there are overdoses or not. And there's some countries that have really taken that on board. So Iceland, for example, where there aren't high numbers of overdoses, they now have OPCs because they've recognized the benefits that this service can offer to people beyond responding to overdose. And so I'm very hopeful for the future. More and more countries are catching on to the value of these services. And yeah, I'm hopeful.
Tiffany is a registered nurse in a consumption and treatment centre in Hamilton, Ontario, Canada. The service runs out of St. Paul's Presbyterian Church, which are happy to house a small supervised injection site, and it's only 200 metres from a daycare centre for children. Tiffany's service also offers drug checking facilities. Reverend Mark Lewis from the Presbyterian Church says that the service has reduced violence significantly since it opened 6 years ago, and that the organisation is, quote, an exemplary tenant, and the staff are dedicated and caring.
Steel booths here. They're set up the same way for every client. We have a mirror, a light so that they can visualize their vessels better, a biohazard bin, and then typical harm reduction supplies that are used most often. The tables are sanitized in between each client by staff with a bacterial virucidal wipes that kill bloodborne infections. We have a time limit in the interest of flow for the CTS site. So when it's busy and there's like a lineup of people waiting to come in, we'll ask that people spend 20 minutes here consuming, either orally, nasally, or by injection, and then move over to our chill out space where there are chairs in the same space for them to sit down and relax. And we just monitor them closely to ensure that they're not overdosing.
And do you have emergency calls required to save people here, or are you able to manage most actions on site here?
So most often overdoses are managed in-house. So if we're seeing a mild overdose, it's something that's often managed with oxygen therapy or positive pressure ventilation, which is with the ambu bags. If it's something that is not being resolved with those two modalities, then we would move on to naloxone. And then our policy here is that once we've naloxone somebody twice, it's automatically a 911 call, because we know that that means that they're going to require extended monitoring because they took more than one naloxone to resolve their symptoms of not breathing effectively or enough.
Thank you, Tiffany. And have you ever had anybody die in the facility?
No, we've never had a death here.
And how long have you been running the facility?
This CTS has been existing for I think 5 or 6 years now. It's been here for 3 years. I think we're in the 4th year now at this site.
You're open 7 days a week?
Yes.
And what hours are you open?
Monday to Friday, 10 a.m. to 10 p.m. and on the weekends, 4 p.m. to 11 p.m.
Part 2 of this documentary focuses on stakeholder engagement, which includes meeting with people who use drugs, clients of the consumption rooms, neighbours who live in the vicinity, the police, media and NGOs. Part 2 starts with Florian Meyer, who heads up the Department of Social Affairs in the city of Zurich. Florian is responsible for the city's 3 drug consumption rooms. Each allows micro-dealing, and the 3 facilities have staggered opening hours so as not to burden one area the whole time.
My name is Florian Meyer. I'm the division head in the Department of Social Affairs of the City of Zurich, and I'm responsible for 3 drug consumption facilities and the Drug Information Center. We have 3 facilities here in the City of Zurich. 2 of them are in the city center and 1 is in the suburban area. That's very important to not burden the one area the whole time. So we shift the scene from one place to the other one during the day, 365 days a year. And that works because of some important key factors. And one of the main key factors is to address the needs of the people. And that includes that we have also the supply of the drugs here in these facilities. So we tolerate micro-dealing in the facilities. That's very important because otherwise it's outside, somewhere on the street, and that's there. We don't want it to have it there because we always have this push factor, this magnet factor. People from other cities come and buy drugs here, consume somewhere in the public space, and that's why we try to bring the scene into our facilities. And that works because we are a little bit like a restaurant. We give them food, they can sleep here also, they can work here. It's a low threshold job opportunity. And they can stay here the whole day if they want. Yeah.
And thank you, Florian. And can you just explain very briefly when these facilities first opened in Switzerland? What happened? What was the driving force behind the politicians that decided to do something about this crisis in your community?
That was in the 90s. Here in Zurich, there was a huge open drug scene, one of the biggest of Europe, with a lot of problems. A lot of people were dying, a lot of hepatitis C and HIV infections. And it was a bit trial and error. There was a lot of law enforcement and also social work measures, but they didn't work together. So, and people realized that law enforcement makes no sense when there is no place for these people. So they can't bring that. Yeah, that's why they realized we need drug consumption facilities. So then it works. You can do pressure outside with the police, and if you have a place like this safe haven here, this drug consumption facilities, the people go here and consume here. But that works only if this micro dealing is also possible. Yeah. And I think it was like a national trauma a little bit. Until now, there are many people remember this time, and no one wants to go back to the 90s. That's why everything is quite pragmatic here. Also, this micro dealing thing. Yeah.
And just briefly about your community engagement with residents, with businesses and with police, like key stakeholders, how do you manage that?
We realized that the measures are only effective if law enforcement work hand in hand with social workers. We have different goals, but we work together, and we have these commitments. The police, they don't control in front of our facilities, because all of our clients, when they come, they carry drugs on them. So if the police is controlling, the people don't come, and that's the police know that. So, but on the other side, we also know if the police is not controlling outside in the public area, our facilities are not they're not really attractive for these people. So it's sometimes when the weather is nice, like today, it's more beautiful to smoke crack cocaine in the park somewhere outside. So that's work. Yeah, we work hand in hand. And because we have the scene inside, it's also compatible with the surrounding area, with the neighborhood, with the people in the neighborhood. So we work also together with them. We have this stakeholder meetings every 6 months, the regular ones. And there's the police, there is SIP Zurich, this outreach social work unit. There are people from the cleaning unit of the city, and all neighbors who wants to come, shop owners, property owners. And they come and we discuss together the problems, and that makes it very easy to communicate to the people, and they understand what we do. We are the measure against this problem of open drug scene, of open drug consuming and dealing. We are the measure against it, and we are not the problem. We are not the source of the problem. So, but we always have to explain this, because until now, many people, they think you are here, now we have problems in the neighborhood. But we are the solution against the open drug scenes, to the needs of the people, and then you will reach them. And if you don't do that, you will not reach them, like you can see in many other cities in Europe. The open drug scene is outside. A social worker must go outreach somewhere to reach the people, and they have a lot of they have much more serious health problems in the cities, what we can't see here. So we can connect them to the medical outreach clinics. We can connect them to the to other social worker units and so on. So I think that's very important. Yeah.
And you still have the support of the City of Zurich in everything that you do in this space?
Yes, and since last summer, since we had these problems with our facilities and this little open drug scene, it was obvious for all citizens again that there is still an open drug scene, because we are like, the problem was a little bit, the citizens, they didn't see anything anymore. Also the politicians, they didn't see the drug scene anymore, because our measures were that effective. So that's why it was quite important last summer, this example also. And since then we have much more, we already had a lot of support, but since then we have much more support of national politicians. Yeah.
Orville Burke invites politicians to his events at Black Cap in Toronto. He thinks it's important to hear their stories and for them to hear their stories. He thinks it's easy to demonise someone you don't know. Substance users are real people with real lives, and we find that most people make assumptions about what people think and believe. Orville represents both sides of harm reduction, as a beneficiary and a provider of harm reduction services.
I'm Orville Burke, and I'm the Director of Health Promotion at Black Coalition for AIDS Prevention in Toronto. I consent to this recording being used in Judy's Churchill Fellowship Report. Now, my experience of engaging with government and other authority figures is to tell stories and to not make assumptions about, what they think and what they believe. So last year I held a flag raising ceremony for International Overdose Awareness Day, and I invited our provincial member of parliament, Jill Andrew, and she revealed to me that nobody had ever asked her to speak on the issue of substance use or harm reduction before, and how heartened she was at the opportunity. She then went on to share stories, personal stories about her experience of friends, family members who have dealt with the issue of substance use and the impact that has had. Some have lost their lives, some's health have failed, and others have just not been able to recoup and get back to where they were. She was in tears as she spoke. So this really said to me that these were things that were very dear to her. And ever since that, she has worked with us at every opportunity when it relates to anything that promotes harm reduction. Another thing that I realized is that it's easy to demonize someone when you don't know them. It's easy to tell stories about people, and to think the worst of folks when you have no interaction with them. But as soon as you do, you begin to realize that, for example, substance users are real people with real lives, and that potentially you may even know someone who's a substance user who's using in secrecy and shame because of the fear of stigma. But when you begin to engage with these folks, you realize just how much they're regular people like me. I'm someone with substance use history. I had a very tumultuous experience with substance use, but I have benefited from harm reduction efforts. I think I'm the product of harm reduction efforts, and I represent both sides of that coin. I'm somebody who benefited from the work of harm reduction, and I'm also somebody who has turned around to deliver those services and to ensure that programming meets the needs of those persons who need it. And so I think it speaks volumes to what stories can do and what exposing individuals to real lived experience can do. Most of the time, there is a bit of a hesitance on the part of substance users to tell their stories and to be open about it because of the fear of stigma. But I think in those cases, those wonderful moments when people overcome that fear and tell those stories, I think the dividends have been significant. And it is my hope that we will continue to leverage exposing decision makers to persons with lived experience, exposing the broader community to persons with lived experience, and letting them know just the diversity of what substance users look like. They're lawyers, they're doctors, they empty your trash, they sweep the streets. They're your sons, your daughters, your grandmother. It's in my work, I have come to realize that this is the reality of substance use. And the sooner that we begin to realize this, I think that the sooner more people get on board with harm reduction and in trying to reduce the harms of substance use rather than casting judgment.
Tony Smith works at Drug Policy Alliance in New York City. In that role, she assists On Point in Harlem manage community, political, and media attention. Tony believes that the media is skewed towards telling negative, provocative stories about the clients and the workers at On Point. She also believes that community members who are in support of the services aren't as vocal and get less attention than those who don't support it.
Hi, my name is Tony Smith. I'm the New York State Director at the Drug Policy Alliance. I do consent to being videoed for Judy's fellowship. And I'm going to share a little bit about my involvement with On Point NYC, which is the organization that operates the 2 overdose prevention centers in New York. They are the first and currently still only recognized overdose prevention centers in the United States, although more in other states are on the way soon. I work at the Drug Policy Alliance, which is a national policy advocacy organization working to end the drug war in the United States through changing laws, policies, hearts, and minds. And my work is to specifically change laws, hearts, and minds in New York State as it pertains to drug policy and how we treat people who use drugs. And for the past 2 years, I've been working very closely with OnPoint NYC as they have operated these overdose prevention centers and really have been needing to provide very high quality services while at the same time being the center of a lot of media attention, community attention, and political attention. And so my role extends beyond overdose prevention centers. However, as part of my broader policy advocacy work in New York, it has been very important to be a close partner with OnPoint so that a lot of the requests that they are getting and the kind of considerations that they're needing to navigate that extends beyond service delivery, I am able to provide support and help to translate the work that they are doing here out into public and political messaging. Thinking about how to reduce the burden on the staff here as they receive requests for tours through the building and helping to be someone who leads some of the tours or supports the staff in leading some of the tours, and then helping to do the follow-up with people who have visited so that that's not on the staff to make sure that people who visited know how to make sense of what they've just seen and how they kind of put in place or actualize what they've learned into their own communities based on touring this place, the centers, while reducing the burden on staff. Another thing that we do together is kind of work together on how we communicate the work that's happening here to the community and through media. We know that media is drawn to very sensationalized headlines. And when it comes to drug use, this often means that media is skewed toward telling negative, provocative stories, often tokenizing stories related to people who use drugs and people who provide services to people who use drugs. And so what gets less attention are the community members who do support these services. I often say that people who support the work of OnPoint NYC and other harm reduction organizations don't stand on the corner and yell about how much they love the services. People who love what's happening in their community go about their day loving what's happening in their community. However, we know that people who are unhappy are often louder, more organized, and have more urgency to make sure they are making demands. And so part of our work together is also working to counter and balance the types of stories that people are hearing about services that exist in their community and other communities, and also making sure that people who support these services get as much airtime and visibility as people who oppose it, so that we're getting a more representative look at how community members think and feel about the issues in their communities. And so this includes working together on being thoughtful about what stories we want to tell. And while OnPoint can focus on telling the stories of their participants and service delivery, my role at Drug Policy Alliance means thinking about how to tell these stories in the political context and making them more advocacy oriented.
Dr. Thilo Beck is the head psychiatrist at ARID, which was established in 1991 in Zurich as a result of the opioid crisis in Switzerland. ARID employs 120 staff and has 5,000 patients in the biggest outpatient clinic in Switzerland. Thilo and his team provide integrated, flexible treatment that is tailored to the client's needs. After initial resistance, ARID's neighbours became more in favour of the services that they offered and understood it was to their benefit as well. Thilo advocates for regulating substances, and he wants to end the prohibitionist approach. He says that our clients would be in a much better state of health if substances were regulated.
My name is Thilo Beck. I'm head psychiatrist here at ARID. We have been operating here now since '91, and I think we are functioning as a pressure group, so to speak, in a sense that we do the the interventions, the treatments in the way we think they are appropriate, and that was to start with against the rules in the 90s. And we learned that when you do things right, they are accepted or seen, and so it's like an example of good practice that we live here. And so I can tell the impact it has on my colleagues here in Switzerland, but also internationally. We have a lot of delegations coming here to visit and to see, to understand and learn how we work here. And I'm really proud of it. And it's so good to see how our clients and patients also appreciate this kind of attitude and approach. It's all about integrated, flexible treatment offers that are tailored to the needs of our clients. And that means that we have to listen well and respect the needs of our clients and understand the needs of our clients to then, together with them, create the treatment they benefit most. And this approach is, I think, the most effective one to have an impact on the well-being of our patients here.
And Thilo, can you just explain how you work with politicians to make this happen in Switzerland?
Well, I think, as I told you, we are a pressure group, and how can that be? Because we are quite a big organization. We have 120 staff and 5,000 patients in treatment, so we are the biggest outpatient clinic in Switzerland. And I do a lot of networking in Switzerland. I'm a member of the Swiss Society of Addiction Medicine. I'm in many other boards and try to have an influence on political negotiations, and that works quite well since we are quite big, as I said, and we are actively communicating as well. That makes a difference too. We really work closely with the media, and so we have a voice, and we use that voice. And I think politicians accept us and respect us as a player in the field with a good practice, right? And so that gives us some impact, I think.
That's right. And also, one other piece of information you gave me was your engagement with the local residents, stakeholders at the town hall meetings.
Yeah.
Could you just explain that?
Well, that was when we moved in here 2017. That was a big thing, right? To move into this big building and with 120 staff members and 5,000 patients coming here into this area. And so we very early communicated when we signed the contract. That was 2 years before we moved in here. We already contacted the neighborhood, we introduced ourselves, we sent out letters, we invited for meetings, and after opening of the operation, we continued to do town hall meetings like every 2 or 3 months. In the beginning, even more frequently, and that helped a lot. And after some resistance to begin with, the neighborhood people understood what we were doing, and they really got more and more in favor of our services here, and understood that this is to their benefit as well.
Yeah, that's great. And finally, what's your sense of the future for harm reduction internationally? You're an international player. What's the sense of hope there, if we can all come together in understanding this health issue?
Well, I think we still live off what we learned back in the 90s, and that was a very important experience when we came up with this new approach, the 4-pillar policy, the integration of harm reduction. And I think we are now trying here at our roots to expand this harm reduction approach that was developed in the opioid epidemic to all other fields of substance use disorders or addiction related problems. And this logic and rationale of harm reduction I think can be used in a broader range of problems. And so I think, and that's also a political thing, to advocate for a regulation of every single substance and to get an end to this prohibitionist approach, because we are sick of treating the problems that are created by prohibition. I think our clients would be in a much better state of health if substances were regulated, and that gives us also a lot of energy to advocate for that.
Mary Ellen Rooney is the director of the ABC School in Harlem, which is opposite On Point NYC. Her school is child-focused and family-focused and community-focused. On Point is in the right place, she says, and it is a wonderful neighbour and a great part of their community. They have a close relationship with the parents and staff who access On Point's holistic treatment services and therapies such as Reiki, massages, acupuncture and sound therapy.
Hello, I'm Mary Ellen Rooney. I'm the director of the Graham School here at the Association to Benefit Children, which is on 126th Street in East Harlem. In particular, on here in 126th Street, across the street, we have a harm reduction center, and right across, not even 30 feet, we have this beautiful school. And at this school, we provide services to children from prenatal all the way up to age 18 to 21. We have babies, we have children who have complex health needs, we have children with special needs, with autism and intellectual disabilities, feeding disorders, children who, adolescents who are struggling with their own mental health, families that, have food insecurity challenges. They are asylee seekers in shelters, experienced harm in so many ways, and our children have these adult stressors that you can't even imagine. But here we are having this, open your doors, and we provide all the services for our families. We are child focused, we have a family focus, and we're community focused. Without the community, we couldn't do the work that we do. So in particular, yes, it might be hard to walk down a street and see some needles, see people lying on the floor, see people looking like that they're going to self-harm or fall over. But what's important is the word people. They're people. We're people. We're here to do what we need to do for each other and hope that others would do for us when we need it as well. So in terms of On Point, yes, there's been a lot of controversy. There's been a lot of rallying and talking about why are they here across from the school? Why here? Why here? Why here? You know what? This school is in the right place. On Point is in the right place. We're here at the right place at the right time, in the right moment, to really, really rally behind the community. And I provide compassionate work that supports the children, the future as well, making sure that people are not dying, making sure that people are understanding their choices, understanding that there is help for them. And in doing so, right across the street from the school, yeah, it's challenging. It's very challenging. But we have a close relationship with our local New York City Police Department. We have a very close network with our EMS, and around, across the street as well. If we need something, they're here. They're here in the morning, making sure that there are no needles that our children can pick up. They're making sure that if we're going to a trip to the library, there are there are internal crossing guards, you know, that come with their suits on. In fact, some of our families were actually employed by them because, you know, they're building and they're growing and they're looking for community members who can also support. And that's something, hey, our people are looking for work, so why not? But now we have somebody to go to say, hey, you know what, you want a shower? Come on in. Let me test those drugs for you to make sure that, you know, that they're safe. Hey, do you want to check out this program? Making sure that their doctors are able to respond even quicker sometimes than our EMS trying to get down traffic. So they're at the ready, willing, and able. And in terms of our partnership has become so close that the holistic healing pieces of what they do that's so important, our families can't access that. Regular health care or public health care can't access those other types of treatment. So what did we do? They came on over. They brought their holistic healing approaches to our families and to our staff for self-care, whether it's massages, whether it's acupuncture, Reiki, or whatever you believe in, beat therapy, you can learn about it. Sound therapy, oh my goodness, if you want to be relaxed, just listen to the sound therapy. And their doors are open for our families and our team members. And it's been such a relaxing time for our teachers who are boots on the ground every single day.
Tony Duffin is the CEO of Anna Liffey Drug Services in Dublin. He told me about COVID lockdowns and the interesting impact that it had on the people who use drugs in that area. They were able to provide accommodation in Dublin city centre for people with addiction, and GPs removed caps on methadone treatment and benzodiazepine stabilisation prescriptions. With their needs met, with accommodation, with food, people focused on other parts of their lives, for example, study. The benzo and methadone arrangements are still in place in the City of Dublin to this day.
So I'm Tony Duffin, I'm the CEO of Anna Liffey Drug Project here in Dublin. So just to give you some insights, particularly around COVID. During COVID, we had a situation, obviously, where we had to get people to safe spaces and such, and there was a great piece of work done by the HSE and the Health Service Executive in Ireland and the Department of Health and the NGOs all working together. But the first thing, one of the first things that happened was getting people into accommodation, and people went into hotels in Dublin city centre and got given, you know, some really good quality housing at that time in terms of the hotels that were being used. We made sure that people had food and lots of clothes were donated and things, and we made sure that people were looked after. One of the really important things for people who use drugs is getting, I suppose, the medication that they need. And we ensured that people were able to get onto methadone quickly so they could isolate. And that was changed actually quite well by the Health Service Executive here. They managed to reduce the waiting times from 12 weeks to 2 to 3 days, and how they did that was they removed the caps on general practitioners, and that led to people getting access much faster. The other thing that we were able to do, and with the permission of the Health Service Executive, was to provide people with benzodiazepine stabilisation prescriptions, something that we hadn't been able to do here in Ireland before, and people were placed on those appropriately through the GPs onto those prescriptions, and the end result was that people had the medication they needed. They were living somewhere where, you know, which was a good standard, and they were sort of safe and well, and started to think about other parts of their lives. Indeed, I can think of one example where a young man who I'd known for many years came along and was asking about a course, an educational course that he really wanted to get onto. Would that have happened without those things being in place? or they hadn't happened before for him. So it does give me some insights into that. So I think that those particularly around the benzodiazepines and the methadone, those things are still in place to this day.
Guy Felicella is truly someone who has lived experience and understands complex challenges and the unaddressed societal issues in downtown East Side Vancouver. The crisis has been caused by an unregulated toxic drug supply, homelessness and poverty. Casual substance users are tragically impacted as well. Guy describes his medical diagnosis at the age of 38 of ADHD was a game changer for him. It gave him an understanding of why he is who he is.
G'day Australia. My name's Guy Felicella and I'm a former drug user in Vancouver, British Columbia who had to be brought back to life 6 times. Obviously we have many complex challenges and unaddressed societal issues, which is, causing the catastrophic nature of the crisis that we're involved in, which is predominantly caused by the unregulated toxic drug supply, where 6 people are dying every single day in British Columbia to the poison drug supply that contains fentanyl, benzos, nitazines, and other vet drugs that are in them. We also have a major housing crisis in the province of British Columbia as well, where people are struggling with homelessness and poverty. And we also have services to reduce those harms that are in our society, such as harm reduction measures and treatment and detox measures. The challenge with all of this is that there's many people who are using these toxic drugs that do not struggle with an addiction, but they're just casual intermittent substance users and who are consuming their substances on the weekend, but they don't know what they're consuming. Sometimes it could be cocaine and sometimes it could be cocaine mixed with fentanyl, and that is catastrophic for an opiate naive user. So we have all these challenges in our society, but the major impacts of all of it is that we just haven't been able to adapt the policies to change as fast as the toxic drug supply, and that's sadly why we are in the challenges that we're facing. And it's not just in Vancouver, it's right across North America. And so a timely response is to make sure that we have scaled up harm reduction programs such as supervised consumption sites, access to safer alternatives such as hydromorphone or heroin programs to remove people from using that toxic drug supply. And then also to people to have access to detox and treatment services. And what a lot of people often believe with harm reduction is that it enables people to continue using substances. This is actually incorrect. What harm reduction does is enable people to actually live to hopefully one day figure out a pathway to recovery or a better pathway of wellness. But people don't recover when they're dead. And so having supervised consumption sites and access to safer supply programs are vital in saving people's lives and reducing the harms caused by the unregulated toxic drug supply. We have in the downtown east side where we are right now is that we have many complex challenges in a community, but predominantly this is the lowest poverty district in Canada. And so when you have poverty and people struggling with intergenerational trauma, you have people looking to distract themselves from what their circumstances are. I truly always say this to people when I'm doing talks is one thing is that are you happy or are you distracting yourself from sadness? Because in my life, I was really distracting myself from the sadness more than I was happy. And that sadness came from struggling with addiction, struggling with undiagnosed learning disabilities, struggling with the lack of housing, struggling with the lack of support. And then people saying these simple slogans like stop using drugs or get off drugs. Sure, it sounds very simplistic, but it's very challenging because I get off the drugs many times throughout my life. And I'd have a few better things such as a bed or a place to sleep. or some housing. Unfortunately, what didn't get better was how I felt about myself as a person from the trauma and the abuse that I endured as a child. And so it took me many years to deal with the trauma and not knowing that I had ADHD until I was 38. So once I put the pieces together that I was burying the trauma to not deal with it, the drugs were the solution to the trauma. Once I started to understand who Guy was and the undiagnosed learning challenges that I faced, I started to put the pieces of the puzzle together, and then I was able to, treat the addiction that I was struggling with for 31 years. And so take it from a guy who had to be brought back to life 6 times. I needed a tremendous amount of support from community for decades to get me to the place. And today I have an amazing life. I have almost 12 years of sobriety. I have a family. I have 3 beautiful children. I went from homeless to a homeowner. I have a career. But really, the reason why I do what I do today is so I educate high school students, galas, conferences globally, in the hopes to share my story of overcoming all these challenges, that people don't fall down the same path that I did. And if you do fall down the same path that I did, it's okay, because there is support and there's people that care, like myself and many others. You just have to find the right people to support you, and hopefully you do. So keep up the good work out there in Australia, and I hope to be out there one day soon. Thanks for listening.
The interview with Guy Felicella concludes part 2 of the documentary. The objective of my Churchill Fellowship documentary and report is to provide plain language information about supervised drug consumption facilities and their potential benefits to people who use drugs and the broader community. This information is based on evidence provided by international experts, research, and people with lived experience. Here's my call to action. 1. Watch all 31 unedited interviews, which are hyperlinked in the executive summary. 2. Please share this information and your thoughts with your family and friends. 3. Contact your local, state and federal Member of Parliament to share your concerns about this issue of drug harm. 4. State your support for increasing harm reduction services, including supervised consumption sites, drug checking services, increasing counselling and treatment services, and decriminalising the possession of a small amount of illicit drugs, as is the case in the ACT. I'm Judy Ryan. Thanks for your interest.